The esophagus is a muscular tube that connects the pharynx to the stomach, facilitating the passage of food and liquids. Its anatomy can be broken down into the following components. 1. Regions of the esophagus. Cervical esophagus, located in the neck, extending from the cricoid cartilage to the thoracic inlet. Thoracic esophagus, lies within the thorax, extending from the thoracic inlet to the diaphragm. Abdominal esophagus, the short portion that passes through the diaphragm to join the stomach. 2. Layers of the esophagus. Mucosa, the innermost layer containing epithelium, stratified squamous non-keratinized epithelium. Lamina propria, loose connective tissue. Muscularis mucosa, thin layer of smooth muscle. Submucosa, contains blood vessels, lymphatics, and esophageal glands for mucus secretion. Muscularis externa, 2 layers of muscle, inner circular muscle, outer longitudinal muscle, proximal third, skeletal muscle, middle third, mixed skeletal and smooth muscle, distal third, smooth muscle. Adventitia, or serosa, in the abdominal region, the outermost connective tissue layer providing structural support. 3 sphincters, upper esophageal sphincter, US, comprised of cricopharyngeus muscle, prevents air entry during swallowing. Lower esophageal sphincter, LS, a physiological sphincter at the gastroesophageal junction, prevents acid reflux. Top 4, blood supply, arterial supply, cervical esophagus, branches of the inferior thyroid artery. Thoracic esophagus, esophageal branches from the thoracic aorta. Abdominal esophagus, left gastric artery and inferior phrenic artery. Venous drainage, cervical esophagus, inferior thyroid veins. Thoracic esophagus, azygos and hemiazygos veins. Abdominal esophagus, left gastric vein, part of the portal venous system. Hack 5, lymphatic drainage, upper third, deep cervical lymph nodes. Middle third, mediastinal lymph nodes. Lower third, left gastric and celiac lymph nodes. 6, nerve supply, parasympathetic innervation, vagus nerve, cranial nerve X, sympathetic innervation from sympathetic trunks and greater splanchnic nerves. 7, histological features. The esophagus exhibits specific histological features distinct from other parts of the gastrointestinal tract, notably its thick muscular walls and stratified squamous epithelium, which is adapted to handle abrasion from swallowed food. Each part of the esophagus works in concert to ensure the proper passage of food to the stomach while protecting against mechanical and chemical damage.